Question 1. When a client is scheduled for a transesophageal echocardiogram, TEE, which task may be assigned to the unlicensed assistive personnel, UAP? C. Remove the water pitcher from the client's bedside. The UAP may only perform basic tasks with a predictable outcome, such as removing the water pitcher from the client's bedside. The nurse must ensure that the client has signed the informed consent, give the client pre- and post-procedure instructions, and assess the client's anxiety level. Question 2. The Quality Improvement Team is considering an initiative to prevent falls. Which action will be most successful? A. Frequent rounds of patient rooms. When the staff makes the rounds, they can notice current risks and can intervene right away. Rounds also provide an opportunity to teach patients and families about fall risks. Question 3. Which of the following findings indicates the need to immediately stop a treadmill, exercise, stress test? A. Chest pain of 4 on a 0 to 10 scale. A report of chest pain can indicate myocardial ischemia. The test should be stopped immediately to avoid injury or infarction. An exercise stress test is usually performed on a treadmill. It requires about 8 to 12 minutes of making the heart work harder than baseline. The test is stopped for client complaints of chest pain or dizziness, severe or unexplained shortness of breath, extreme hypertension or hypertension, arrhythmias, or abnormal changes in the ECG. Changes in vital signs related to exercise, such as increases in blood pressure and pulse and a decrease in oxygenation, are considered normal and should continue to be monitored. Question 4. Before a patient is transported to surgery, the operating room calls the unit nurse to administer the preoperative medication as ordered. After giving the medication, the unit nurse discovers that the patient did not sign the surgical consent. What should the nurse do first? C. Notify the nursing supervisor. When reporting an incident, start with the next person in the chain of command. Depending on the facility, you may need to complete a report for the quality improvement or risk management departments. The nursing supervisor may assume responsibility for the process or ask the nurse to notify the surgeon and OR. Question 5. A nurse who works in the oncology unit has been floated to the intensive care unit, ICU, for the shift. Which client is most appropriate to assign to the nurse? C. A client with a pulmonary embolism. The oncology nurse should be assigned the client with the pulmonary embolism. The client will likely be on anticoagulant therapy and supplemental oxygen. This client is the most hemodynamically stable. The other clients require monitoring by skilled critical care nurses. Question 6. When signing a document as a witness, your signature indicates that the patient C. was of legal age and the correct person to be signing the form. Your signature as a witness only states that you have verified that the person signing the form was the person who was listed in the document. Question 7. An adult female client with a severe mental developmental delay will be scheduled for surgery. Which action should the nurse take first to obtain informed consent? B. Verify the identity of the client's legal guardian. It is the surgeon's responsibility to provide informed consent. The nurse's role in obtaining informed consent is to verify the identity of the person who can provide it, so legal documents will be valid. Mental competency is determined outside the healthcare setting, as is information about informed consent and advance directives. If clients or guardians have questions, the nurse can direct them elsewhere. Question 8. On reporting to his med-surg unit, a nurse is told that he has been pulled to the ICU. The nurse has never worked in the ICU and is hesitant to float for his shift. What should he do? B. Go to the ICU and perform safe tasks. Being floated or pulled to another unit is acceptable and legal. To provide safe care to patients, the new unit should provide orientation to the nurse before the nurse is assigned to stable patients that are similar to those normally cared for. Refusal to float can result in termination. Question 9. Which type of law deals with felonies and misdemeanors? B. Criminal law. Criminal law deals with those who are suspected of committing misdemeanors and felonies. Statutory law involves legislative bodies. Common law is based on previous legal cases. Administrative law is determined by administrative bodies, such as state nursing boards. Question 10. During a routine checkup, the nurse tells the client, "Let's get your weight." When the client willingly steps on the scale, what type of consent was given? C. Implied. Implied consent occurs when both parties silently agree without a formal discussion. Verbal consent is the client's spoken understanding of the procedure to be performed. Written consent is a legal document, usually signed by the client after an explanation of the procedure by the physician who will perform it. Assumed consent is not a term used. Question 11. A client comes to the clinic with complaints of heart palpitations, shortness of breath, fatigue, and syncope. An ECG indicates atrial fibrillation. When the nurse performs an assessment, which finding is most concerning? A. Difficulty speaking. Difficulty speaking is indicative of a stroke. During atrial fibrillation, AF, the atria beat chaotically and irregularly out of coordination with the ventricles. Atrial fibrillation symptoms often include heart palpitations, shortness of breath, chest pain, fatigue, weakness, lightheadedness, fainting, and intolerance of exercise. The heart rate in AF can range from 100 to 175 bpm, sometimes higher, reducing cardiac output by 10 to 30%. AF causes a higher risk of stroke, due to the inability of the atria to contract. This leads to blood collecting in the atria and clot formation. Anticoagulant therapy is a priority in managing AF. Type 2 diabetes is a risk factor for developing AF, but is not the greatest concern at this time. Unplanned weight loss should be investigated, but is not the priority at this time. Question 12. When the home health nurse checks on a client, the client's attorney is present and asks for the nurse's signature as a witness on a living will. What is the nurse's most appropriate action? C. Decline to witness the client's signature on the living will. Living wills are documents that need to be signed by the client and witnessed by either non-agency personnel or a notary public. For the nurse to sign it would represent a conflict of interest. Notifying a supervisor or signing as a witness or to the client's signature is inappropriate. Question 13. An adult client with a devastating head injury is declared brain dead. The nurse notifies the local organ donation agency, who sends a coordinator to review the case. The coordinator notes that the client did not indicate they wish to be an organ donor on the state's donor registry and that the client is divorced. Which family member will the organ coordinator contact first to obtain consent for donation? B. Adult child. When a client is unable to indicate their wishes, does not have a living will, or is deceased, state law determines who can give consent for treatment, donation, or disposition of the body. Surrogate consent laws specify the hierarchy of family members who can provide consent for the client, whether living or deceased. The order is 1. Spouse, unless divorced or legally separated. 2. Adult child. 3. Parent. 4. Adult sibling. Some states also list other family members after these, as well as friends or a person authorized to dispose of the body. If no one is available, the court can appoint a guardian. Question 14. A new unlicensed assistive personnel, UAP, takes an oral temperature of a client and notes that it is 102 degrees Fahrenheit 38.9 degrees Celsius. The UAP quickly approaches the nurse to report the temperature, telling the nurse that the previous reading was 99.2 degrees Fahrenheit 37.3 degrees Celsius. The nurse enters the client's room to perform an assessment and sees the client drinking a cup of hot tea. What instruction should the nurse give to the UAP? A. Remove the tea and retake the client's temperature in 20 minutes. Wait at least 1 hour after heavy exercise or a hot bath before measuring body temperature. Wait for 20 to 30 minutes after smoking, eating, or drinking a hot or cold liquid. Question 15. A client who was admitted for observation following a heroin overdose gets dressed and informs the nurse that he is leaving. He has no discharge order. What is the nurse's best action? A. Ask him to sign an Against Medical Advice (AMA) form. Unless court-ordered, clients have the right to self-determination and can leave without a discharge order. Detaining, restraining, or sedating a client constitutes false imprisonment. The nurse should request that the client speak with his provider before signing the release or leaving the facility, so the provider can explain possible consequences. Question 16. A client is admitted with a diagnosis of central diabetes insipidus, related to insufficient secretion of antidiuretic hormone, AD. Which urine-specific gravity result supports the diagnosis? C. 1.002. A urinary specific gravity of 1.005 or less and a urinary osmolality of less than 200 mol/kg are indicators of diabetes insipidus. Diabetes insipidus is caused by a lack of antidiuretic hormone, ADH, also called vasopressin, which prevents dehydration, or the kidney's inability to respond to ADH. ADH enables the kidneys to retain water in the body. When diabetes insipidus is caused by a lack of ADH, it is called central diabetes insipidus. This form of the disease can be caused by damage to the hypothalamus or pituitary gland. The normal range for urine-specific gravity is 1.005 to 1.030. Question 17. The nurse receives shift report and prepares to make rounds. Which of the following clients should the nurse see first? B. A client with an above-the-knee amputation who is complaining of severe heartburn. The nurse should first see the client who is complaining of heartburn, to determine if it is chest pain that needs to be evaluated. The nurse can ask a UAP to assist the client who needs to urinate. The temperature of the client with the hip replacement is normal for the post-op period. The client with COP should be seen second to determine if their O2 cannula is in place and if the confusion is consistent with their medical history. Question 18. Nurse practice acts are an example of C. Statutory law. Statutory law comes from authoritative and legislative sources. Each U.S. state has enacted a Nurse Practice Act, which establishes licensing agencies or boards that develop rules and regulations and oversee the practice of nursing. Question 19. A client assigned to a new nurse experienced a fall when getting out of bed. When the nurse completes the incident report, they give it to their supervisor and state, "I'm so worried that I will get fired." The supervisor explains that the purpose of an incident report is to B. Collect data so similar situations can be prevented. An incident report is an electronic or paper document that provides a detailed, written account of an unforeseen circumstance in a healthcare setting. And NBSB. Its purpose is to identify and eliminate risks so that future events can be prevented. Incident reports help improve safety and quality of care, as well as customer satisfaction. They also serve as training tools. They are not meant to punish staff or to alert attorneys of possible litigation. Nursing schools are not under the jurisdiction of a hospital. Question 20. Which of the following is not considered protected health information, PHI? B. Pedometer log. There are specific identifiers in medical records that can potentially identify an individual or be traced back to an individual. This could result in revealing information about a person's healthcare services, including diagnosis and treatment. A pedometer log is not linked to health records, so it's not considered to be protected health information, PHI. Examples of PHI are any address information lower than state level, dates, telephone or fax numbers, medical record numbers, vehicle identification numbers, vehicle license plate numbers, names of family members, and device serial numbers. Question 21. An arterial line may be used for all the following purposes except A. Measuring cardiac output. An arterial line, ART line, is a small catheter, similar to an intravenous, that is inserted into an artery. They are commonly used in critical care for several purposes: arterial blood tests, such as blood gases, ABG, easy blood draws for laboratory tests, closed blood pressure monitoring. And NBSB. Cardiac output can be measured with a pulmonary artery catheter, such as a Swan-Ganz catheter. Question 22. Which is appropriate to include in a staff nurse's performance evaluation? C. List of strengths and weaknesses. A performance review should provide a complete picture of how a nurse is doing at a given point. This includes an evaluation of the nurse's strengths and opportunities for further learning or improvement. Question 23. A female patient with a diagnosis of terminal cancer has a do not resuscitate (DNR) order. She stops breathing. Her husband begs the nurse, "Save her." What should the nurse do? C. Remind the husband that a DNR order is in place. Generally, a family member cannot override a DNR order, which is between a patient and their physician. The nurse should be aware of the patient's living will and power of healthcare attorney status. Question 24. When you are planning nursing care for a patient with a different cultural background, what is the first step? B. Assess cultural variables that could affect the patient's treatment plan. By identifying and assessing the patient's cultural needs, the nurse can better understand how customs and rituals might influence the patient's diagnosis, treatment, or healthcare management. Question 25. The nurse is caring for a client with a diagnosis of severe liver disease. Suddenly the client starts to vomit bright red blood. What is the nurse's priority action? A. Ensure a patent airway by client positioning and suctioning. The nurse should first establish a patent airway by placing the client in a position to allow them to spit out the blood and to minimize aspiration. The nurse should suction excess blood and mucus. Notify the critical care team and the HCP. The client has bleeding esophageal varices, related to their liver disease. Blood flow from the liver has been slowed, causing pressure in the portal vein to push blood into the vessels of the esophagus. Bleeding is a medical emergency and can be fatal in about 50% of clients. Blood pressure and pulse should be monitored. The other options may be considered after establishing a patent airway. Question 26. A client with a previous diagnosis of early-onset Alzheimer's disease is scheduled for a common surgical procedure. If the nurse is concerned about the client's ability to give informed consent, which of the following actions would be most appropriate? B. Contact administration for hospital policy. Informed consent can be obtained only from an adult patient who is mentally competent to sign it, except under certain circumstances and situations. When consent cannot be obtained, other people can provide legal consent for the patient. If the nurse has any concerns about the client's ability to sign or which other persons can sign, the nurse should contact the appropriate administrator for guidance consistent with policy. The other options are unethical and illegal. Question 27. A client with a diagnosis of Huntington's disease is admitted to the long-term care facility for basic care. What is the first step in developing the client's plan of care? B. Determine the client's ability to perform activities of daily living. Before developing a plan of care, always do an assessment. For this client, determine what they can do independently, so those activities can be supported and maintained. Huntington's disease, HD, is a progressive brain disorder caused by a defective gene. This disease causes changes in the central area of the brain, which affect movement, mood, and thinking skills. The other options should be included, but are not the first step. Question 28. Parents bring their 7-year-old son to the emergency department because they think he has a fractured ankle. During the physical assessment, the nurse notes multiple bruises and cigarette burns on the boy's arms and trunk. Which is the nurse's most appropriate action? A. Notify the supervisor to report suspected child abuse. All healthcare professionals are required to report suspected child abuse. Demanding an explanation from the parents assumes that the parents are responsible, which may not be the case. It may not be possible to obtain accurate information from the boy either. Many children are coached what to say. The nurse does not have the authority to keep the parents from taking their son home. Question 29. Which of the following tasks can be assigned to an experienced certified nursing assistant, CNA, who is helping to care for a patient on a ventilator? C. Measure vital signs and pulse oximetry readings every 4 hours. A certified nursing assistant's educational preparation includes measurement of vital signs, including how to check oxygen saturation by pulse oximetry. Tasks beyond the CNA's education level are outside the CNA's scope of practice. Assessing and observing the patient, checking ventilator settings, and suctioning require the additional education and skills of an RN. Question 30. A client presents to the emergency department with an oxygen saturation, SAR2, of 78%. The client is able to breathe without assist. What oxygen delivery system will best increase the client's SAR2? C. Rebreather mask. A normal O2 saturation is an GT, 94%. When SAR2 is below normal, the O2 delivery system depends on the SAR2 level. A nasal cannula is a low-flow device used for mild hypoxia. It can be set between 1 to 6 liters per minute, LPM, delivering 24 to 40% FiO2. FiO2 is the fraction of inspired oxygen, the concentration of oxygen in the gas mixture. The gas mixture at room air has a fraction of inspired oxygen of 21%. A simple face mask is also a low-flow device, set between 5 to 10 LPM, delivering 35 to 55% FiO2. A non-rebreather mask is a low-flow device that uses a reservoir bag to deliver a higher concentration of O2. The one-way valve prevents inhalation of expired air. It is set between 10 to 15 lpm, 80 to 95% FiO2, and used for severely hypoxic clients who are able to ventilate well. A Venturi mask is a high-flow device that delivers a precise measurement of O2. It has different sized ports to change the amount of FiO2 from 24 to 50%. Question 31. The nurse working in a long-term care facility is assigning tasks for a 77-year-old resident who is experiencing hyperglycemia. Which of the following tasks is appropriate for the unlicensed assistive personnel, UAP? B. Record the resident's food and fluid intake during the shift. The nurse can assign the UAP to record the resident's dietary intake. The UAP can give a bed bath and inform the nurse if they observe edema, but only the nurse can assess the resident. The UAP can also notify the nurse if the resident shows a change in alertness, but it is the nurse's responsibility to monitor and document any alterations and notify the provider of them. The UAP may not make any changes in the plan of care. Question 32. The nurse's neighbor tells the nurse that their adult child just got engaged. The nurse works at a local clinic and knows that the fiancé recently tested positive for human immunodeficiency virus, HIV. What is the nurse's legal obligation? C. Offer no indication of knowledge of the HIV status. The nurse has a legal and ethical obligation to maintain confidentiality of health status. The client will receive counseling when advised of their HIV status, and is legally obligated to inform all sexual partners. The couple is able to prevent HIV transmission with safe sexual practices. Additionally, they may have chosen not to share the information with anyone. Question 33. A critical pathway is an important tool in managing the quality of care for a client. As part of this, variance analysis is used to recognize and intervene when a client's care doesn't follow the expected progress. What is the time frame for variance analysis during hospitalization? B. Continuously from admit. A clinical pathway is a care plan with details of the essential steps that organize and sequence the interventions for a diagnosis. Variance analysis and NBSB is the difference between actual and planned behavior. Variance analysis is ongoing from the time of admit or start of treatment, to identify and alter any events or situations that could adversely affect the outcome for the client. Question 34. Following surgery, the patient was returned to the unit and is complaining of pain on a level of 9 out of 10. The nurse reviews the chart and finds the surgeon's order for 10 mg MSO for written postoperatively. Before administering morphine, what should the nurse do first? C. Contact the surgeon before proceeding. The surgeon should be contacted because the surgeon's order doesn't indicate how the medication should be administered. Also, MSO4 can mean magnesium sulfate as well as morphine. Remember the rule to prevent medication errors: the right patient, the right and NBSB, drug, the right dose, the right route, and the right time. This order needs to be clarified. Question 35. A client with a diagnosis of stage 4 cancer is alert and oriented, has designated a close friend to be their durable power of healthcare attorney. The friend tells the nurse, "As durable power of healthcare attorney, I will be making all treatment decisions from now on." What is the nurse's best response to the friend? B. You can only make decisions if the client is unable to do so. A durable power of attorney for healthcare and NBSB is a legal document that helps people plan for medical emergencies and decline in mental functioning. A durable power of attorney for healthcare names a person, often referred to as an agent, to make medical decisions on your behalf if you are no longer able to make healthcare decisions for yourself. A durable power of attorney deals with finances, not health decisions. The friend does not have to remain at the client's bedside, and they do not have automatic access to the client's health records. Question 36. The RN in a busy pediatric unit is making shift assignments. Which of the following patients is most appropriate for a new graduate nurse? C. A 13-year-old with sickle cell disease, care of lower right quadrant, abdominal pain. A new graduate nurse can safely assess pain for a patient with sickle cell disease and administer pain medication. The patient with hemophilia who has become less responsive must be assessed for a possible intracerebral bleed and prompt intervention. The postoperative patient who is swallowing frequently may be bleeding, requiring assessment by an experienced nurse. Accurate teaching about insulin is crucial, because it is a high-alert drug that the patient's parents must learn to manage. Question 37. The nurse is using a computer in the hallway to document on a client's electronic health record. When a nearby call light goes on, the nurse still has more information to document. What is the nurse's best action? C. Log off the computer and go answer the call light. The nurse should log off the computer and answer the call light. Documentation can be completed later. After finding out what the client needs, the nurse may be able to ask a UAP to help. Leaving the computer on gives others an opportunity to read private information and is a HIPAA violation. Finishing documentation before tending to a client is inappropriate. Question 38. A nurse has been assigned 4 patients. Which patient should the nurse assess first? C. A 34-year-old with copious secretions from a new tracheostomy. The patient with a tracheostomy should be assessed first. There is a risk of a compromised airway from the secretions. Remember, the airway, breathing, and circulation (ABC) assessment is always the priority. Question 39. A nurse working in a remote setting relies on telemedicine communication to provide care and education for clients. What is a primary benefit of using telemedicine from the client's perspective? A. Telemedicine removes time and distance barriers to receiving care. The benefits of telemedicine, telehealth, video conference, for patients include the following. 1. No transportation time or expenses. 2. No time lost from work. 3. No child or elder care issues. 4. Easier scheduling or on-demand capability. 5. Access to specialists. 6. Reduced risk of disease transmission. Telemedicine is useful in many settings, not just remote or rural areas. Technology is not more expensive, clients can use a phone, email, or video. There is no guarantee of increased motivation or health record standardization. Question 40. After having had a skiing accident, a 16-year-old male is brought to the emergency department and requires life-saving surgery. The family has been notified, but they will not reach the hospital for 2 hours. What is the best way to obtain consent for treatment of this patient? A. Obtain phone consent with a second nurse as a witness. In a life-threatening emergency, if the family can be notified, they must give their consent on behalf of the surgeon. Telephone, verbal, consent, with a witness, can be obtained from the legal next of kin. Documentation of the consent by the nurse and witness is required. Question 41. The nurse is subpoenaed to give a deposition in a case that a client filed against the hospital and every staff member who documented care for him. What is the nurse's best response when the client's attorney asks, "Did you provide care for the client on this date?" D. Yes. When called to give testimony for a case, do not give more information than is being asked. Give a definitive response, but offer nothing more. The nurse should confirm if care was given that day and nothing more. In this question, the nurse is not being directly sued. Determining if the nurse was on duty that day can impact anyone who came in contact with the client. The nurse should provide a simple answer, yes or no. It's important to note that the nurse is not being directly sued, but the hospital. The nurse should not give any more information than what is being asked directly. Question 42. The charge nurse is making assignments for the shift. A young client who has remained unresponsive after sustaining a traumatic brain injury will be transferred from the hospital to a long-term care facility. Which staff member is most appropriate to provide care for this client today? D. Registered nurse. A registered nurse should care for this client and coordinate the transfer to the long-term care facility. RNs are responsible for performing procedures to safely transfer a client, receive and transcribe HCP orders, provide information for handoff of clients, assess the need for referrals, and maintain client confidentiality and privacy. The RN may also assess the need for referrals and identify appropriate community resources. For the transfer of this young client, the RN will identify and include necessary documents, and communicate with staff at the long-term care facility. Question 43. The clinic nurse calls a client who has missed 2 checkup appointments for her baby. The mother states that she has problems with transportation. The nurse should refer the mother to D. The clinic social worker. The clinic social worker should know of community resources that can assist the client. These may include a local volunteer agency that provides transportation for medical appointments. Question 44. A 16-year-old male calls the clinic because he's worried that he might have gonorrhea. However, he doesn't want his parents to know. What should the nurse tell him? D. We can test you without parental consent, but if there are positive results, we must notify the health department. Some states have a minimum age, 12 to 14 years, for seeking treatment for sexually transmitted infections. In any state, however, adolescents can be seen without parental notification or consent. The HIPAA privacy rule protects the client's information and prohibits sharing it without the client's permission. However, the law mandates that certain infections, including gonorrhea, be reported to public health departments. Question 45. When sharing a patient's medical history and care information with another provider, how much can the initiating provider disclose? D. The minimum information necessary. When discussing and sharing a patient's information, share only enough information to allow for safe and appropriate treatment. Any information not related to care must be protected. Question 46. During an annual checkup, a 50-year-old client asks the nurse about advance directives. Which of the following statements by the nurse is correct? D. It is a legal document that states your wishes if you can't. An advance directive is a document through which a person makes provision for healthcare decisions in the event that they become temporarily or permanently unable to make those decisions. There are two main types of advance directives: a living will and a durable power of attorney for healthcare. There are also hybrid documents that combine elements of the living will and durable power of attorney. No one is required to have an advance directive, but it is a useful legal document for an adult of any age to plan for future healthcare needs. Question 47. The nurse on a medical unit is caring for a client with a diagnosis of SARS-CoV-2, COVID-19. Which of the following findings requires immediate intervention? D. Pulse oximeter, SpO2, of 92%. COVID-19 clients can develop silent hypoxia, with SpO2 values of until T, 94%, even when appearing comfortable and in no distress. Low SpO2 can indicate COVID-19 pneumonia and the need for supplemental O2 or a ventilator. SARS-CoV-2 and NBSB winking sad smiley severe acute respiratory syndrome coronavirus 2 can cause a wide range of symptoms: fever, chills, cough, muscle body aches, headache, sore throat, congestion, nausea, vomiting, loss of taste, smell, or diarrhea. Emergency intervention is necessary for dyspnea, persistent chest pain or pressure, inability to wake or remain alert, cyanosis of lips or face, new onset of confusion. The CDC considers a fever to be an GT, 100.4 degree F, 38 degrees Celsius, which is managed by nursing interventions and medications. Pulse oximetry should be monitored for SpO2 and GT, 94%, less than 94% can indicate hypoxia and the need for immediate intervention. Question 48. The Code of Ethics for Nurses was written and published by the D. American Nurses Association. The American Nurses Association, ANA, Code of Ethics describes the obligations and duties of every nurse. It is the nursing profession's non-negotiable ethical standard. The Code of Ethics was last revised in 2015. The ANA was founded in 1898. The National League for Nursing was founded in 1893. Question 49. When a nurse is making shift assignments, which patient is most appropriate for a nursing assistant? D. A post-hysterectomy patient who needs to ambulate. The nursing assistant can help with ADLs and can therefore assist the hysterectomy patient with ambulating, bathing, and other basic care. The RN will be responsible for the other patients, who will require assessment, teaching, and other interventions ordered by physicians. Question 50. What kinds of private health information are protected by the HIPAA privacy rule? D. All of the above. Protected health information, PHI, is any information in a chart or medical record that could be used to identify an individual. It's a combination of health information and personally identifiable information, PII, in any media, written, electronic, or verbal. Anything that can connect a patient with their medical information is covered by the HIPAA privacy rule. Question 51. Many lawsuits involving a nursing professional happen when the nurse D. Follows an order that is incomplete or incorrect. Nurses are responsible for implementing doctors' orders. They are also responsible for questioning the doctor about an order that seems incomplete or incorrect. If an inaccurate order is followed and the patient suffers harm, the nurse can be held liable if the doctor was not contacted. Always document communication with physicians when questioning an order. If unsure, ask a supervisor. Question 52. During a client's hospitalization, they refused all personal care by nursing staff. About 18 months later, the client brings a lawsuit against the hospital, claiming negligence for failure to provide basic care. Which documentation by the nurse will be most useful during the lawsuit? D. Client stated, "Leave me alone. I can do this myself." A nurse never knows when a client may bring a lawsuit. Documentation that is thorough, including client statements, is the best defense if a lawsuit is filed. Vague documentation, such as client refused treatment, does not give evidence that efforts were made to provide care. Subjective documentation, such as client seems, has no value because it is an impression, with no supporting evidence. When a client refuses care, is not compliant, or other unusual instances, the nurse must document objectively. Question 53. When the nurse is assigning care of a newly admitted client to an unlicensed assistive personnel, UAP, which instruction is best? D. Starting at 9 a.m., empty the Foley every hour and write the output on the board by his bed. When assigning tasks, directions must be clear, concise, correct, and complete. An example of directions that meet these requirements is to empty the Foley and record the amount hourly, starting at 9 a.m. The answer options related to ambulation, measuring the client's vital signs, and morning tasks are vague and incomplete. The UAP cannot assess a client. Question 54. A client with an aggressive glioblastoma discusses treatment options with his oncologist. When he considers two drastically different options, which ethical term describes his right to make a self-directed decision? D. Autonomy. Autonomy is the right to make independent, self-chosen decisions after receiving enough information to determine treatment. Beneficence is the moral obligation to do good and what is best for the patient. Non-maleficence is avoiding a harmful action or not doing harm. Consequential is an ethical theory. Question 55. The nurse is documenting on a client with a diagnosis of schizophrenia. The client had approached the nurse to warn that the water on the unit was being poisoned with arsenic. What is the best way for the nurse to document the client's behavior? D. Client states, the water on the unit is being poisoned with arsenic. Documentation must be clear and factual, providing as much information as possible. Including the client's actual statement is objective. Interpreting the client's experience can be subjective or diagnostic. Simply documenting that the client is concerned is vague and unhelpful for others who will read the medical record.